Well, turning to our coronavirus coverage now, Nevada reported more than 500 new cases of COVID-19 today. There were also 10 additional deaths reported, bringing the total to more than 1,550. Brian Hoffman spoke with state health officials about different tests that are used now and ones that might be used in the future.
Nevada has done a lot of testing since the start of the pandemic.
Nevada has now completed a total of 996,307 molecular tests since the beginning of COVID-19.
And they plan on doing a lot more, especially heading into the winter season. Because of this, the state testing laboratories plan to include the flu test with every coronavirus test. But there have been some questions about the accuracy of testing, if labs mess up, or even if they're being performed properly.
And if a lab does not pass those proficiency tests, they are not allowed to offer SARS-CoV-2 testing.
Dr. Pandori does warn that getting a test too early after getting exposed to the coronavirus may give a false negative.
They actually may not have enough virus at that point in their nasopharynx or in their throat to be detectable on the test.
And speaking of false negatives, neither the state or Washoe County are using the rapid test antigen tests, as those have been found to not be as accurate as the molecular model.
So that would knock them down to the 70 to 85% range, which is the trade-off for being a fast test that can be performed at point of care.
Nevada was sent some of those rapid tests, which were distributed to local hospitals and care facilities. Covering the story, Brian Hoffman, 2 News.